Welcome to affordable ACLS.com. Section 1. Understanding the silent cardiac killers PEA and Asystole. In the high-stakes world of emergency medicine, every second counts. Few situations are as dire as a patient presenting with pulseless electrical activity, or asystole, two conditions that fall under the umbrella of cardiac arrest. These conditions are often referred to as the silent killers because despite what may appear on an EKG, there is no effective heartbeat, and time is of the essence. Understanding the nuances of PEA and Asystole is paramount for any healthcare provider tasked with saving lives. Pulseless electrical activity, as the name suggests, is a condition where electrical activity is present on an EKG, but there is no corresponding pulse. Imagine a conductor leading an orchestra, the baton moving rhythmically, but no music emanating from the instruments. Similarly, in PEA, the heart's electrical system sends signals, but the muscle itself fails to contract effectively, leading to a lack of blood flow. This absence of a palpable pulse is what makes PEA so dangerous, as it can easily be mistaken for a less critical condition if not assessed carefully. Asystole, on the other hand, represents the complete absence of electrical activity in the heart. If PEA is a conductor desperately trying to start a silent orchestra, Asystole is the eerie silence of an empty concert hall. The EKG in Asystole will show a flat line, indicating the heart is no longer generating the electrical impulses necessary for life. Both PEA and Asystole are life-threatening emergencies requiring immediate intervention. The key takeaway here is the critical difference between electrical activity and mechanical function of the heart. While an EKG can show a seemingly normal rhythm in cases of PEA, the absence of a pulse reveals the terrifying reality. The heart is not pumping blood. This underscores the importance of always checking for a pulse as part of the initial assessment of any patient suspected of being in cardiac arrest. Every passing second without effective circulation causes irreversible damage, making rapid diagnosis and intervention absolutely crucial. Section 2. The EKG paradox: normal rhythms, absent pulse. The complexity of PEA lies in its misleading presentation. Unlike other cardiac arrest rhythms that exhibit distinct abnormalities on an EKG, PEA can masquerade as normal sinus rhythm or sinus bradycardia. This EKG paradox often leads to delayed treatment, as healthcare providers may initially be deceived by the seemingly normal electrical activity. Imagine looking at a clock with perfectly aligned hands, ticking away as if time is flowing normally. Now imagine that same clock, hands frozen in place, time standing still. This is the deceptive nature of PE. The electrical impulses, like the clock's hands, can appear normal, while the heart itself, like the stopped clock, fails to perform its vital function of pumping blood. This deceptive nature of PE underscores the importance of a multifaceted approach to patient assessment. Relying solely on EKG readings can be misleading and potentially fatal. Healthcare providers must always prioritize a physical assessment, including checking for a pulse, to confirm or rule out PEA. Recognizing this potential pitfall is crucial in emergency medicine. When a patient presents with a loss of consciousness, the first instinct might be to focus on the heart monitor. However, the absence of a palpable pulse should immediately raise red flags, even if the EKG displays a normal rhythm. This is a crucial moment where experience and a deep understanding of cardiac physiology are essential for making life-saving decisions. Section 3. Combating PE, a race against time. Treating PEA is a race against time. Unlike shockable rhythms like ventricular fibrillation, where defibrillation can restart the heart, PEA does not respond to electrical shocks. Instead, the focus shifts to high-quality CPR as the cornerstone of treatment, aiming to manually circulate blood and buy precious time. Think of CPR as a manual override for the heart, keeping blood flowing to vital organs while the underlying cause of PEA is addressed. The human body can survive for only a few minutes without oxygen, making every compression a lifeline for the patient. Effective CPR involves compressing the chest at a rate of 100 to 120 beats per minute, ensuring adequate depth to circulate blood effectively. Alongside CPR, The ACLS protocol for PEA emphasizes the prompt administration of 1 milligram of epinephrine intravenously or intraosseously. Epinephrine acts as a potent vasoconstrictor, narrowing blood vessels and increasing blood pressure to improve blood flow to the heart and brain. This medication serves as a bridge, attempting to jumpstart the heart back into a rhythm that can sustain circulation on its own. However, medication alone is not enough. During epinephrine administration, CPR must continue uninterrupted, ensuring that the drug reaches its target tissues efficiently. The combination of high-quality CPR and timely medication administration forms the core strategy for managing PEA, providing the patient with the best possible chance of survival. Section 4, the ACLS Playbook, Rhythmic Vigilance and Medication. In the midst of a PEA crisis, healthcare providers must maintain constant vigilance, meticulously following the ACLS protocol to optimize patient outcomes. Rhythm checks every 2 minutes are crucial, monitoring for any changes that could signal a transition to a shockable rhythm, or ideally, a return of spontaneous circulation, ROC. Imagine a ship navigating through a treacherous storm. The captain and crew must constantly monitor the radar, looking for signs of danger and adjusting course as needed. Similarly, during PEA resuscitation, each rhythm check serves as a radar pulse, providing vital information about the patient's condition and guiding the next steps in treatment. Epinephrine administration is repeated every 3 to 5 minutes, maintaining a consistent level of the drug in the system to support blood pressure and improve the chances of ROSC. In some cases, vasopressin, another potent vasoconstrictor, may be considered as a substitute for or in addition to epinephrine. This rhythmic approach to medication and monitoring underscores the importance of teamwork and communication in emergency medicine. While one healthcare provider administers CPR, another manages the airway, and yet another prepares and administers medications. Clear communication and synchronized actions are paramount to ensure no precious seconds are wasted during this critical period. Section 5. Beyond PE, Navigating the Shifting Sands of Cardiac Arrest. Treating PEA and Asystole is not just about following a rigid protocol, it's about understanding that a patient's condition can change rapidly, requiring healthcare providers to adapt their approach accordingly. Continuous monitoring for transitions to other rhythms, particularly shockable ones, is essential. Think of it as a game of chess, where each move depends on the opponent's last. In PEA management, the opponent is the ever-changing state of the patient's heart. The medical team must anticipate potential changes, be prepared to switch tactics, and adjust treatment strategies based on the evolving situation. If a shockable rhythm is detected, the focus immediately shifts to defibrillation, delivering a controlled electrical shock to reset the heart into a normal rhythm. This highlights the dynamic nature of cardiac arrest management, where treatment pathways can change rapidly, requiring healthcare providers to be adaptable and ready to adjust their approach at a moment's notice. Throughout this process, the ultimate goal remains the same: achieving ROSC and restoring a normal heart rhythm. The ACLS protocol provides a framework, but it is the clinical judgment and expertise of the medical team that truly dictates the course of action. By understanding the nuances of PEA, mastering the ACLS protocol, and remaining adaptable to the ever-changing dynamics of cardiac arrest, healthcare providers can make informed decisions that give their patients the best chance of survival. Earn your certification today at affordableacls.com.